World Patient Safety Day, 17 September. Kindly note that this is an awareness video only. Viewers are advised to verify the contents before using this information anywhere else. World Patient Safety Day is observed annually on 17 September by World Health Organization. The objectives of World Patient Safety Day are to increase public awareness and engagement, enhance global understanding, and spur global solidarity and action to promote patient safety. 134 million adverse events occur each year due to unsafe care in hospitals in low and middle income countries, contributing to 2.6 million deaths annually. 4 out of 10 patients are harmed in the primary and ambulatory settings. Up to 80% of harm in these settings can be avoided. The most detrimental errors are related to diagnosis, prescription, and the use of medicines. Medication errors cost an estimated $42 billion annually. The occurrence of adverse events due to unsafe care is likely one of the 10 leading causes of death and disability in the world. Unsafe surgical care procedures cause complications in up to 25% of patients. Almost 7 million surgical patients suffer significant complications annually, 1 million of whom die during or immediately following surgery. Unsafe injection practices in healthcare settings can transmit infections including HIV and hepatitis B and C, pose direct danger to patients and healthcare workers. Diagnostic errors occur in about 5% of adults in outpatient care settings, more than half of which have the potential to cause severe harm. Most people will suffer a diagnostic error in their lifetime. Unsafe transfusion practices expose patients to the risk of adverse transfusion reactions and the transmission of infections. Radiation errors involve overexposure to radiation and cases of wrong patient and wrong site identification. Errors can occur at different stages of the medication use process. Medication errors occur when weak medication systems and/or human factors such as fatigue, poor environmental conditions, or staff shortages affect prescribing, transcribing, dispensing, administration, and monitoring practices, which can then result in severe harm, disability, and even death. Antimicrobial resistance threatens the effective prevention and treatment of an ever-increasing range of infections caused by bacteria, parasites, viruses, and fungi. Antimicrobial resistance happens when microorganisms such as bacteria, fungi, viruses, and parasites change when they are exposed to antimicrobial drugs. 810 women die every day due to preventable causes related to pregnancy and childbirth. The most common direct causes of maternal injury and death are excessive blood loss, infection, high blood pressure, unsafe abortion, and obstructed labor, as well as indirect causes such as anemia, malaria, and heart disease. How can the patient care be improved? Infection prevention and control program needs to be established at national levels. Clean care including hand hygiene, best practices by nurses and midwives is crucial. Most maternal deaths are preventable with timely management by a skilled health professional working in a supporting environment. Health worker safety is a priority for patient safety. Safe health workers means safe patients. An example of prevention is engaging patients. If done well, it can reduce the burden of harm by up to 15%. To realize the benefits of quality health care, health services must be timely, equitable, integrated, and efficient. To ensure successful implementation of patient safety strategies, clear policies, leadership capacity, data to drive safety improvements are all needed. A cornerstone of the discipline is continuous improvement based on learning from errors and adverse events. Focusing on the system that allows harm to occur is the beginning of improvement, and this can only occur in an open and transparent environment where a safety culture prevails. This is a culture where a high level of importance is placed on safety beliefs, values, and attitudes, and shared by most people within the workplace. If you like this video and want to view more such useful videos, kindly subscribe to my channel.